Fabulous. So just by way of a quick introduction, my name's Helen Payne. I'm the Head of Continuous Improvement at Midlands Partnership University NHS Foundation Trust. It's a bit of a mouthful. I'm not a clinician by background. My background is admin. I've done various different roles in my career in the NHS, from medical secretary, exec PA, business manager, and finally found my calling, I think, in QI back in about 2012. And myself and a colleague were the founding members of the QI team back in 2013. So knowledge is very much in quality improvement and very new to the world of sustainability and the green agenda, although I'm learning fast, as you'll see as we go through. And I'll let Joe introduce himself.
Good afternoon, everyone. Joe Wickens, QI facilitator. I've worked in NHS for many years, and I started out as a occupational therapy assistant in the trust, a few years in higher education. Then I came back into digital. I worked in communications, and now I am in quality improvement. So I've sort of been around the place and experienced various aspects of the NHS.
That's a very wide skill set, which we're very pleased to have in the QI team. So just to give you a bit of context about the organisation, really, we're a large organisation that covers a wide geographic area. We've got about 8,500 staff, predominantly based in Shropshire, Telford and Wrekin, Staffordshire and Stoke-on-Trent area of the Midlands, but we have got specialist services that cover a much wider geography, all the way down to the Isle of Wight and much higher north. I'm not sure where our north is, most north services. So yeah, so that's the size of the organisation that we're working with. We're a very small quality improvement team, but as you can see from the slide, our quality improvement team sits under a wider continuous improvement umbrella. So my line manager, the associate director for continuous improvement and sustainability, has responsibility for all of the areas that you can see in that box. But for the purposes of today, we're just going to focus on the two middle ones, so the QI team and the green team. But we just wanted to sort of put it in context as to how closely we work together under that continuous improvement umbrella. So how we started the journey, obviously as an organisation, we wanted to respond to our responsibilities and to think about how we want to work towards that target of net zero by 2040. So it was decided that we would establish a green team, and that would sit with Katie, my line manager, who I just mentioned. And we also needed to think about how that linked to our QI approach. As I said, we started the QI team back in 2013. So now we've got quite a well-established quality improvement methodology that we use. And we were thinking about how we embed sustainability into that. And it was a bit strange for me as well to have something completely new that I didn't have much knowledge about to sort of embed into our training. So it was a bit of scary unknown to begin with. Then we got in touch with the Centre for Sustainable Healthcare, and I have to say that they've been a huge help to us on this journey in terms of their guidance, sharing information, a lovely leadership style that they've got in terms of mentoring and coaching. So that's big shout out to everyone at the Centre for Sustainable Healthcare for all their support that they've done. Couldn't have done it without them, really, I don't think. And the other important part at the start of the journey was about how the QI team linked with the green team and how we were going to embed SUSQI together and collectively. So one of the early things that we did was said, you need to help us learn, but will you learn what we do as well, so that you understand where we're at? And that really helped. So the members of the green team, they're only a small team as well, 2 people. They did our leading quality improvement training and were able to give us great advice as to where within that training different aspects of the sustainability information, the green agenda could fit into that nicely. So that was really good. And one of the things that we did really early doors as well to sort of help that joint working was myself and Monica Hornikova, who's the head of the green team, were asked to deliver some training to district nurses at Keele University as a joint thing. We got some real learning out of that, to be honest, because the way we structured our presentation was me delivering QI at the start of the session, then I handed over to Monica and she delivered the sustainability and the green agenda and talked about net zero. After that, we said we can do better than that. We need to merge this so it's together instead of there and then there. So then that was a great early learning, sort of jump in the deep end kind of an experience. I have to give credit to Joe for these slides, by the way. I don't have the skills to make slides look this beautiful. So this is our journey. Joe didn't purposely put them on a very linear time frame because lots of different things were happening at the same time. So we talked about the regular conversations we had with the Centre for Sustainable Healthcare. That started to happen. I started to develop an action tracker because it felt like a massive piece of work to embed this into everything, and I needed to break it down into smaller bite-sized chunks. The Trust established a strategic sustainability group, which was led by one of our exec directors. We realised that we really needed to listen to feedback from people to understand their concerns. There was a bit of resistance in the QI team to start off with, not in a really negative way, but just sort of a lack of confidence, not understanding what exactly we'd got to build in and how it was going to look. We needed to look at all of our materials in all the different levels of training and think about how that would fit in. Lots and lots of team discussions that we had to have to sort of build that confidence, practice teaching the stuff between us in a safe space. And as I said, the green team undertook their LQI projects as well. By way of measuring as well, we also undertook the educator maturity assessment to see where we were at before we started the journey, which was very, very low scoring on that. And we're going to reassess that as we go through. And then obviously we're really proud to say that on the 29th of August, we gained established beacon site status and have put the logo on everything, including our backgrounds and everything like that. So it is a journey. We know that getting that logo is wonderful. We've still got a long way to go. As I said, we're a huge organisation. We have built SUSQI into all our training. We're having conversations. We're running events from a SUSQI perspective now instead of just a QI perspective. But we've got a long way to go in terms of rolling it out to everybody and making sure everybody understands what we're trying to achieve, basically. So we are in the process of doing a continuous improvement stock take, which is looking at all those things that I mentioned on the beginning slide as well, not just QI and the green agenda, but other things that come under there as well, to sort of just check where we're at and think about how we continuously improve what we're doing and what our customers want in terms of the organisation, being a corporate service, how we're supporting them. We need to make sure that we've got that broader staff awareness. So we're sort of starting to talk the talk now to people, and it's really good actually, because I went to our business meeting this morning, and when I sort of said, have you heard that we're now an established beacon site, they were all nodding at me. So it's like, right, people are starting to get this awareness out there now, which is really good. We've also developed a standalone SUSQI module, because although we've wanted to build this into our training going forward, we've obviously already trained lots of people previously who haven't had that knowledge around the sustainability agenda so far. So we've done that for people who want to sort of have a top-up sort of thing, but also people who just want to know that aspect of it without going deeply into the QI side of things. So that sort of module will be there for 2 reasons, really. We're also looking to develop senior leadership understanding. As I said, we've got a strategic sustainability group, which is led by our exec director, but we need to do more than that and make sure that they understand their roles and our roles, and that we're all communicating well together. It's also really tricky, I think, for staff on the ground to sort of create time anyway to do their quality improvement projects, but now we're sort of asking them to do something even more difficult and complex if you've not done it before, in terms of measuring those carbon calculations. So it's about making sure that we're supporting them to do that so that they can demonstrate the impact of their improvements as well. We're also part of a wider QI network within the systems that we work in. So we're part of Staffordshire and Stoke-on-Trent ICS and Shropshire, Telford and Wrekin ICS. So we've got QI networks there that we want to influence as well, and make sure it's not just MPFT that we're working in, but also supporting other organisations to think about the green agenda and SUS-QI. And we've got lots of clinical practice networks within the organisation as well, so we want to make sure that we're linking in with those. So, like I said, we're on a journey. There's a long way to go, but I hope I've given you a bit of a whistle-stop tour as to where we're at, sort of thing, and what our next steps are. But just to make sure I haven't forgot anything, we've got some key takeaways. So the first one, and we're when we're putting this together, we're kind of thinking, what do you need from us, really? What are our top tips, sort of thing? So our top tips would be, if you've got a green team or something equivalent, to link in with them really early, because they can be a great asset to sort of help and support you, and kind of better together, really. I know some people aren't lucky enough to have a green team, but it might be somebody within facilities and estates, for example, that's leading on this in your organisation. Taking ownership early on. So yeah, it was really difficult at the beginning to make sure that everybody in the team was on board with this, and sort of taking ownership for it. But once we got the hang of it and realised it wasn't as difficult as we thought, we're all right. It was things like, it's always been our ethos to put the patient first and not focus on the money. And then all of a sudden we were sharing the triple bottom line, which has got a money element to it. So that was just a bit nerve-wracking and thinking, oh, are we going against our principles? But actually, once you got talking to people, you realised, people on the ground do care about the money. They don't want us to waste taxpayers' money. They want it to go to good use. So that's it. We've embraced it now. The other key thing that we learned was that all QI needs to be SUS-QI. So not to do QI projects and SUS-QI projects, but actually every project to have that SUS element to it. Conscious of time, Kim, sorry, I'm whizzing. So integrating environmental aspects within core QI training. So if you have already got QI training set up, do integrate it within it. Don't try and set up something separate. Well, one good reason is because people haven't got enough time to do 2 lots of training, but it really does link quite nicely once you get the hang of it. My action tracker, although it's a very cumbersome thing, it really helped make me break the big pieces of work down into bite-sized chunks and share the load, so it wasn't all just one person doing stuff. So that was really helpful. Just keep chipping away at the little jobs and you eventually knock off the big jobs. Keeping asking the same question. This was something that Joe highlighted was learning for him, was, if you don't understand something and you've asked the question, don't just think, oh, I just don't understand. Ask it again and ask it again and ask different people and get different perspectives, and eventually it clicks. And I think that's a good lesson for any learning, really, not just this. And bring key stakeholders on the SUS-QI journey, because obviously if you leave them behind, it's going to be hard to try and drag them along later on. So pick them up and bring them on your journey with you from the beginning. So